In this video, we are going to see about the spotters in community medicine. Here, we have to understand a few basics about spotters. You have to identify the spotters. After identifying the spotters, you have to write the identification points, how you say that particular spotter. Then you have to write about the uses of that particular spotter. Then you have to think about public health importance. I have categorized spotters into 7 groups. First is your contraceptives. In this video, we are going to deal about a few basics. That is, within 15 to 20 minutes, how can you cover all the spotters? That is the ultimate objective of this session. So we have contraceptive groups. Most commonly kept contraceptives are given here. And moreover, identification of that particular contraceptive will not be a difficulty. So I am straight away going into the points, what you are supposed to write in answer sheets. Here, first is your male condom. So whenever a particular contraceptive is given, you have to write what type of contraceptive it is, whether it is permanent or temporary or barrier or hormonal or intrauterine contraceptive devices. All these things you should mention. You can write the mechanism of action, then the ideal candidates who need that particular type of contraceptive. Anyway, ultimately, you are going to have criteria approach to the patients, that you are going to offer the advantages and disadvantages of each contraceptive. Let the patient have to choose what type of contraceptive he needs. This is the simple basic about contraceptives. So male condom, here I have not mentioned about female condom or diaphragm or cervical cap, etc. It is ideal for newly married, lactating and multiple sexual partners. And the advantage is protection from STDs. It is simple, available and cheap. It needs motivation during sex, which is not needed in the other form of contraceptives. Now we move on to oral contraceptive pills, which is the most effective contraceptive. Mola N and Mola D are the two government preparations. That is 28 days you give these tablets. First 21 days will have this hormonal pills. Then the last 7 days will be just iron and folic acid. So it will cause withdrawal bleeding. That is the mechanism of action. Then we have emergency contraceptive pills. Most commonly used is levonorgestrel. So the most important advantage of this, we can use it as a postcoital contraception, which is followed by intrauterine devices. The first generation are just inert devices. Second generation are the copper containing or silver containing. Third generation are the hormonal releasing. The main disadvantage is the bleeding and pain. Then the terminal methods, which is vasectomy and tubectomy, is generally recommended after 2 children. Permanent method of sterilization. Usually models will be kept in exams. So the disadvantage is reversibility, and you need a surgery for this. This is about MCH group of spotters, that is maternal and healthcare related spotters. We have iron and folic acid, ORS and growth chart. All these can be easily identified. Fourth one, which is Shakir's tape, which is used as a measuring tool for malnutrition. The yellow line indicates mild nutrition, and the red line indicates the severe malnutrition. So this is a normal level. Then we have a baby weighing scale, Salter's type of weighing scale, where we hang the weighing scale. So for baby, we can measure through this baby weighing scale. Then we have Sally's hemoglobinometer for the measurement of the hemoglobin. Then we have a disposable delivery kit containing the essential items for the delivery. Then we have partograph, that is a graph which identifies when to intervene and when to refer the patient. The chart to identify the progress of the labor. It consists of the multiple parameters like fetal heart rate, number of contractions, then pulse, BP, etc. Then we are moving into the nutrition group of spotters. Some are very difficult to identify. The students may not be familiar with food substances. So this is rice. Usually people will do parboiling process, which increases the normal shelf life of the rice so that they can store it for a long time. On this process, we have a nutritional advantage, that the micronutrients which is present in the husk of the rice will go inside, deep inside, and the nutritive value is increased. Milled rice people may get thiamine deficiency and other B complex deficiency also. The basic thing about cereals are they have more carbohydrates. Pulses will have more proteins. That is the basic. So cereal and pulses. Cereal end with L. So all the cereals are deficient with lysine. Pulses end with S. All the pulses are deficient of sulfur containing amino acids, that is cysteine and threonine. Out of the cereals, rice has more lysine. Wheat we can identify. You have to mention about the nutritive value of all the cereals. More or less it will be around 340 kilocalories. So the nutritive value is going to be the same. Why wheat is little superior is because of its fiber content and calcium and mineral contents compared to rice. Then we have maize. This is bajra. Bajra should not be confused with jowar. Bajra is little green in color. This is ragi. It should not be confused with mustard. Ragi is a little smaller when compared to mustard, and moreover, you can witness the difference in the colors intensity. It starts from light brown to dark brown. So that is a ragi. Then we have grams. Grams we can identify. This is tur dal or the red gram. This is masoor dal. This is moong dal, which is a product of green gram. This is the green gram, and moong dal is a product of green gram. And this is urad dal. Urad dal means your black gram, and urad dal is the product of this black gram. So they will while breaking it down, this covering will go off and it will make it as a white color. Then this is the channa dal or your Bengal gram, and there are many varieties with the channa gram. That is roasted channa, roasted Bengal gram. All these varieties are the byproducts of the Bengal gram. Now in nutrition we have soya bean, groundnut and all these can be identified easily, and public health importance and also can be written easily. Now we are moving into the immunization. All these vaccines will be kept as a spotters for you, and the most important thing is you need to remember the national immunization schedule. With that we can easily the answers for this spotters. So basically we have to know what are all the newer additions into the national immunization schedule. We have BCG, hepatitis B at OPV at birth, then pentavalent, fractional IPV, rotavirus, pneumococcal conjugate, measles, rubella, Japanese encephalitis, vitamin A, and DPT booster, measles. This is the age-wise list, and you have to remember the fact that all these injectables are going to be IM, except for your PV and BCG, which is intradermal. And since it is intradermal, we have the dose as 0.1 ml. One more exception is the subcutaneous vaccines, that is measles and JE are subcutaneous vaccines. BCG and IPV are intradermal vaccines. For this intradermal, the dose remains same as 0.5 ml. Then you have to remember about site also. So we have completed due age for that vaccines. Then we have completed the route of the administration. Now we are into the site. Site, how to remember is, all of us know that BCG vaccine site is on the left upper arm. We have one more intradermal injection, so that should be on the other side of the upper arm. So that will be on the right upper arm. Then we have two subcutaneous vaccines. One is on the right, that is measles will be on the right, and Japanese encephalitis will be on the left. Hepatitis B will be on the left. Pentavalent will be on the left again. Fractional IPV will be on the right. Then DPT booster will be on the left. This we have to remember. After 1 year, every 6 months we need to give vitamin A, which is 2 ml, which is equivalent to 2 lakh international units. If it is less than 1 year, that is at ninth month, we give 1 dose of vitamin A, 1 ml, that is 1 lakh international units. If you remember this national immunization schedule, all these lists of vaccines can be easily written in spotters. We should not forget to mention about TT, that it is included in the national immunization schedule for the pregnant woman also. Then immunization part, we have one more group, that is the cold chain maintenance items. That is your day carrier. This box is called as, blue box is called as day carrier, and the white box which is present inside is called as the ice pack. In some departments they may have deep freezers and ice-lined refrigerators to prepare this ice pack. These are all essential components in the maintenance of cold chain of vaccines. And this picture we have this vaccine vial monitor. That is, we have outer circle and inner square. Inner square should be lighter than the outer circle. When its color becomes same, it is becoming unfit to injection. This vaccine vial monitor is just a cumulative measure of exposure to the heat. Then we are moving into the entomology. Here the identification of mosquitoes and larvae is very important. We have 3 type of mosquitoes commonly kept for spotters. That is Anopheles, Aedes and Culex, eggs, larvae, and the adult mosquitoes. Eggs, as the image indicates, it is very clear. Aedes lay eggs singly. That we have to remember. Aedes lay egg singly. Anopheles have the lateral drafts, that is both like when the draft is present, then that is an Anopheles egg. This also is laid singly. And Culex, it lay eggs in clusters. So Culex eggs are in clusters. You have to remember that way. That's how we can identify the eggs. Then when we move on to the larvae, easily it can be identified with the siphon tube. The absence of the siphon tube here indicates it is in the Anopheles species. The very long, slender siphon tube indicates it is Culex larvae. The very short and stout siphon tube here indicates that it is a Aedes species of larvae. This is how you should identify the larvae of different species of mosquitoes. Then for an adult mosquito, basically you have to identify between male and female. Male and female can be identified by the bushy antennas. That is, here the central part is, that is proboscis. This is the antenna, the palpi. If the antenna is bushy, then that means that is a male mosquito. If the antenna is not bushy, which is equivalent to mustache in males, so if the antenna is not bushy, then it is a female. Here we have to identify the species. So first is, you have to look at the wings. If you have any spotted wings, then that is Anopheles. If you have the look at the body, if you have the alternate bands, tiger-like appearance, then that is called as Aedes mosquito. If nothing is there, then that is a Culex mosquito. One more identification is in Culex mosquito, the body will be proportionately very small when compared to the head and the thorax. Then one more identification is through the mouth parts, that is with the length of the palpi and with the length of the proboscis. The length of the proboscis is almost equal, then that is an Anopheles species, that is Anopheles. When the length of the palpi is more than that of the proboscis, then that may be either Aedes or Culex. So we have to write it as Culecine mosquito. These are all the other group of insects which are of medical importance other than mosquitoes. This is the lice. This is the shape itself make you identify it as a head louse. Then this is the pubic louse. More or less the images which is present in the slides will be same. Because of the poor preparation of the slides, it may be very difficult to identify. Now then you have to identify the housefly, how it is different from black fly and the CC fly. Then this characteristic image will represent the rat flea, and we have hard tick and soft tick. This is the soft tick and this is the hard tick. Identify with the shape alone. Then this is the itch mite. Here most important thing is, after identification you have to write what disease they are the vectors, and what is the causative organism, and what is the control measure for the disease. And this is the Cyclops. I'm not going into the details of can be identified easily from the spotters. Theory part you can read. Then coming on to the environment, all this will be kept as models, and here you have to read a little theory after identification of the models. This image shows the personal protective months which are very important in occupational health spotters. We have gloves, helmets, aprons, masks, ear plugs, ear muffs will be there. So all these things are very important in occupational health spotters. Now in environment, the spotters which are very difficult to identify is the Horrocks apparatus, which consists of the 6 white cups and 1 black cup. This is an apparatus used for measuring the amount of bleaching powder needed to disinfect the water. If Horrocks apparatus is the apparatus needed to measure the amount of bleaching powder to disinfect the water, this is the equipment called fluoroscope, which measures adequacy of chlorination after the addition of bleaching powder. So this is the fluoroscope. Based on the color levels, we can titrate how much amount of residual chlorine is present in the water. Then we have sling hygrometer, which is used in the measurement of humidity. We will hold here and rotate this at a constant speed. This will help us in measuring the humidity. Then we have kata thermometer. Kata thermometer, this is the red one, and kata thermometer also helps in measuring the cooling power of the air and also humidity. And we have wet and dry bulb thermometer. This helps in measuring the humidity and cooling power of the air. Then we have maximum and minimum thermometer. This will help in measuring the maximum and minimum temperatures of the day. With this, we are ending the spotters. All the best. Thank you.